Caring for an individual diagnosed with autism spectrum disorder, ASD, can present many challenges. The good news is that there are autism treatment options in Menifee, California, so that you don't have to do it alone. While no autism treatment has been shown to cure autism, several intervention options are utilized to reduce symptoms, improve cognitive ability and daily living skills, and maximize the ability of the child to function and participate in the community. The most widely accepted treatment for individuals diagnosed with autism is applied behavior analysis, ABA, therapy. Applied behavior analysis, ABA, therapy is an evidence-based scientific technique used in treating individuals with autism spectrum disorder, ASD, and other developmental disabilities. In general, ABA therapy relies on respondent and operant conditioning to change or alter behaviors of social significance. The ultimate goal of ABA therapy is for the learner to gain independence by learning and developing new skills, resulting in an increase in positive behavior while reducing the frequency of negative behaviors. Leafwing Center provides applied behavioral analysis therapy in Menifee, California, and in homes, schools, and other locations throughout Southern California, for the treatment of individuals diagnosed with autism. For those Menifee families who are coping with the impact of autism, Leafwing Center's ABA therapy program focuses on improving the learner's foundational behavior and social interactions such as playing, learning, and sharing. Leafwing Center's team of highly trained experts based conveniently near Menifee understand what you are going through and can offer assistance. It is crucial that parents and families have access to autism treatment resources that are geared toward comprehensive, intensive intervention. The sooner an individualized autism treatment plan is put into place, the sooner you will start noticing measurable results. And that is the key, measuring and monitoring every step of the way. At the Leafwing Center, we provide a thorough assessment of every child. Based upon this assessment, we devise a plan moving forward. This is why so many Menifee families have put their trust in the autism treatment resources we offer. Leafwing Center provides autism treatment in Menifee, California. For individuals diagnosed with autism, ABA therapy is an effective program used to teach a learner specific skills that may not be in that learner's repertoire of skills to help him/her function better in their environment, whether that be at home, school, or out in the Menifee, California community. In conjunction with skill acquisition programs, ABA-based interventions can also be used in addressing behavioral excesses, for example, tantrum behaviors, aggressive behaviors, self-injurious behaviors. Additionally, ABA therapy programs are effective in providing training to the learner's parent or caregiver. Contact Leafwing Center to schedule an assessment to begin autism treatment. After the assessment is complete, and your funding source has provided authorization for ABA services, your provider will assign a team for your child. This team will include a supervisor and one or several behavior technicians. Expect to receive a schedule of services before the beginning of each month. Additionally, expect your ABA provider to reach out to you to receive your availability for services and to create a schedule that best fits your loved one's needs. Leafwing Center works with an ever-growing list of insurance providers who offer coverage for autism treatment. We accept insurance coverage from a whole host of providers. Below is a non-exclusive list of those insurance providers we currently work with: Aetna, Anthem, Blue Cross of California, Beacon Health Options, Beacon Health Strategies, Blue Cross/Blue Shield of Illinois, Blue Cross/Blue Shield of Texas, Blue Cross/Blue Shield of Washington, Blue Shield of California, Blue Shield of California, Promise Health Plans. Cigna Comprehensive Care Corporation /Advanzion Solutions Incorporated, Comprehensive Behavioral Care Incorporated, Magellan MHN Managed Health Network Incorporated, Molina Healthcare of California, Health Plus aka Multiplan, Magna Care aka Multiplan Managed Health Network Incorporated aka MHN, Meritain Health, Optum UBH, Optum Health Behavioral Solutions, Pacific Care Behavioral Health SCS UBH aka Optum/UBH, United Medical Resources, United Healthcare, Winstone Behavioral Health. Leafwing Center staff is happy to work with you to help determine if your insurance provides coverage for our ABA therapy services. In skill acquisition programs, a child's repertoire of skills is assessed in the beginning phase of the services in key adaptive areas such as communication/language, self-help, social skills, and motor skills as well. Once skills to be taught are identified, a goal for each skill is developed and then addressed/taught by using ABA-based techniques to teach those important skills. Ultimately, an effective ABA-based therapy program will facilitate a degree of maintenance, i.e., the child can still perform the learned behaviors in the absence of training/intervention over time, and generalization, i.e., the learned behaviors are observed to occur in situations different from the instructional setting. These two concepts are very important in any ABA-based intervention and are both incorporated in every learner's Menifee, California autism treatment program. A child or adult with autism spectrum disorder may have the following problems with social interaction and communication skills: fails to respond to his or her name or appears not to hear you at times, resists cuddling and holding, and seems to prefer playing alone, retreating into his or her own world, has poor eye contact and lacks facial expression, doesn't speak or has delayed speech, or loses previous ability to say words or sentences, can't start a conversation or keep one going, or only starts one to make requests or label items, speaks with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech, repeats words or phrases verbatim, but doesn't understand how to use them, doesn't appear to understand simple questions or directions, doesn't express emotions or feelings and appears unaware of others' feelings, doesn't point at or bring objects to share interest, inappropriately approaches a social interaction by being passive, aggressive or disruptive, has difficulty recognizing nonverbal cues, such as interpreting other people's facial expressions, body postures or tone of voice. In behavior management, the challenging behaviors are assessed for their function in the beginning phase of the services. In this phase, the why does this behavior happen in the first place is determined. Once known, an ABA-based therapy program will be developed to not just decrease the occurrence of the behavior being addressed, but also teach the child a functionally equivalent behavior that is socially appropriate. For example, if a child resorts to tantrum behaviors when she is told she cannot have a specific item, she may be taught to accept an alternative or find an alternative for herself. Of course, we can only do this up to a certain point, the offering of alternatives. There comes a point when a no means no, so the tantrum behavior will be left to run its course, i.e., to continue until it ceases. This is never easy and will take some time for parents/caregivers to get used to, but research has shown that over time and consistent application of an ABA-based behavior management program, the challenging behavior will improve. Leafwing Center is committed to ensuring that each of its learners, as well as the learner's family and caregivers, is comfortable with their assigned Menifee autism treatment therapy team. Particularly in the early stages of the program, rapport building is essential to the success of therapy. The staff assigned to work on your child's team will strive to build a positive relationship with your loved one. Not only is this rapport building important at the beginning of services, it should be maintained throughout the duration of the program. Therefore, families can expect the first couple weeks of ABA therapy to include a lot of play and conversation with their child. Simply put, your child should feel comfortable and have fun with the behavior technicians. This helps ensure that your child associates positive experiences with the behavior technicians. This also helps with learning rates and ultimately produces more desirable outcomes. Expect collaboration and communication from your Menifee ABA therapy team. The supervisor on your team will communicate with you to make sure your questions and goal preferences are addressed. Additionally, with your permission, the supervisor may ask to get in contact with your child's other service providers, speech therapists, school teachers, etc., so that coordination of care can be established and that everyone is working collectively toward the same goals. Our ABA therapy program in Menifee, California mirrors any of our programs regardless of location. We offer services in Menifee to make it convenient for the parents or caregivers to ensure consistency in treatment for the learner. ABA therapy is adaptable to meet the needs of each unique person. Therapy can be offered in multiple settings, home, at school, and in the community. Teaches practical skills that have application in everyday life. Can be offered either in one-to-one or group instruction. Despite where your child may be on the autism spectrum, there is hope for a dynamic, bright and fulfilling future for your child. The sooner autism is treated, the greater the likelihood of positive treatment results. Getting the autism diagnosis is the first step. From there, it's a process of developing relationships with a team of Leafwing Center's well-qualified and experienced treatment professionals who will help guide your family through the various hurdles and challenges you may face. Leafwing Center provides an individualized autism treatment approach that helps ensure your loved one is better prepared to cope with whatever comes his/her way. Taking advantages of resources and services available right here in Menifee is going to be a key part of helping your loved one become more comfortable within a wide array of social settings. There is no one format that will fit all children and their families' needs. The ABA professionals you're currently working with your participation, will develop an ABA-based treatment package that will best fit your child's and your family's needs. For more information regarding this topic, we encourage you to speak with your BCBA or reach out to us at info@leafwingcenter.org.
What is ABA therapy used for?
ABA-based therapy can be used in a multitude of areas. Currently, these interventions are used primarily with individuals living with ASD, however, their applications can be used with individuals living with pervasive developmental disorders as well as other disorders. For ASD, It can be used in effectively teaching specific skills that may not be in a child's repertoire of skills to help him/her function better in their environment, whether that be at home, school, or out in the community. In conjunction with skill acquisition programs, ABA-based interventions can also be used in addressing behavioral excesses, for example, tantrum behaviors, aggressive behaviors, self-injurious behaviors. Lastly, it can also be utilized in parent/caregiver training. In skill acquisition programs, a child's repertoire of skills is assessed in the beginning phase of the services in key adaptive areas such as communication/language, self-help, social skills, and motor skills as well. Once skills to be taught are identified, a goal for each skill is developed and then addressed/taught by using ABA-based techniques to teach those important skills. Ultimately, an ABA-based therapy will facilitate a degree of maintenance, i.e., that child can still perform the learned behaviors in the absence of training/intervention over time, and generalization, i.e., the learned behaviors are observed to occur in situations different from the instructional setting. These two concepts are very important in any ABA-based intervention.
Who can benefit from ABA therapy?
In behavior management, the challenging behaviors are assessed for their function in the beginning phase of the services. In this phase, the why does this behavior happen in the first place is determined. Once known, an ABA-based therapy will be developed to not just decrease the occurrence of the behavior being addressed, but also teach the child a functionally equivalent behavior that is socially appropriate. For example, if a child resorts to tantrum behaviors when she is told she cannot have a specific item, she may be taught to accept an alternative or find an alternative for herself. Of course, we can only do this up to a certain point, the offering of alternatives. There comes a point when a no means no, so the tantrum behavior will be left to run its course, i.e., to continue until it ceases. This is never easy and will take some time for parents/caregivers to get used to, but research has shown that over time and consistent application of an ABA-based behavior management program, the challenging behavior will get better. In parent training, individuals that provide care for a child may receive a customized curriculum that best fits their situation. A typical area covered in parent training is teaching responsible adults pertinent ABA-based concepts to help adults understand the rationale behind interventions that are being used in their child's ABA-based services. Another area covered in parent training is teaching adults specific skill acquisition programs and/or behavior management programs that they will implement during family time. Other areas covered in parent training may be data collection, how to facilitate maintenance, how to facilitate generalization of learned skills, to name a few. There is no one format that will fit all children and their families' needs. The ABA professionals you're currently working with your participation, will develop an ABA-based treatment package that will best fit your child's and your family's needs. For more information regarding this topic, we encourage you to speak with your BCBA or reach out to us at info@leafwingcenter.org.
What does ABA therapy look like?
There is a common misconception that the principles of ABA are specific to autism. This is not the case. The principles and methods of ABA are scientifically backed and can be applied to any individual. With that said, the U.S. Surgeon General and the American Psychological Association consider ABA to be an evidence-based practice. 40 years of extensive literature have documented ABA therapy as an effective and successful practice to reduce problem behavior and increase skills for individuals with intellectual disabilities and autism spectrum disorders, ASD. Children, teenagers, and adults with ASD can benefit from ABA therapy. Especially when started early, ABA therapy can benefit individuals by targeting challenging behaviors, attention skills, play skills, communication, motor, social, and other skills. Individuals with other developmental challenges such as ADHD or intellectual disability can benefit from ABA therapy as well. While early intervention has been demonstrated to lead to more significant treatment outcomes, there is no specific age at which ABA therapy ceases to be helpful. Additionally, parents and caregivers of individuals living with ASD can also benefit from the principles of ABA. Depending on the needs of your loved one, the use of specified ABA techniques in addition to one-to-one services may help produce more desirable treatment outcomes. The term caregiver training is common in ABA services and refers to the individualized instruction that a BCBA or ABA supervisor provides to parents and caregivers. This typically involves a combination of individualized ABA techniques and methods parents and caregivers can use outside of one-to-one sessions to facilitate ongoing progress in specified areas. ABA therapy can help people living with ASD, intellectual disability, and other developmental challenges achieve their goals and live higher quality lives.
How do I start ABA therapy?
Agencies that provide ABA-based services in the home setting are more likely to implement ABA services similarly than doing the same exact protocols or procedures. Regardless, an ABA agency under the guidance of a board-certified behavior analyst follows the same research-based theories to guide treatment that all other acceptable ABA agencies use. ABA-based services start with a functional behavior assessment, FBA. In a nutshell, a FBA assesses why the behaviors may be happening in the first place. From there, the FBA will also determine the best way to address the difficulties using tactics that have been proven effective over time with a focus on behavioral replacement versus simple elimination of a problem behavior. The FBA will also have recommendations for other relevant skills/behaviors to be taught and parent skills that can be taught in a parent training format, to name a few. From there, the intensity of the ABA-based services is determined, again, based on the clinical needs of your child. The completed FBA is then submitted to the funding source for approval. One-on-one sessions between a behavior technician and your child will start once services are approved. The duration per session and the frequency of these sessions per week/month will all depend on how many hours your child's ABA services have been approved for. Usually, this will be the number recommended in the FBA. The sessions are used to teach identified skills/behaviors via effective teaching procedures. Another aspect of ABA-based services in the home setting is parent training. Parent training can take many forms depending on what goals have been established during the FBA process. The number of hours dedicated for parent training is also variable and solely depends on the clinical need for it. If a one-to-one session is between a behavior technician and your child, a parent training session or appointment is between you and the case supervisor and with and without your child present, depending on the parent goals identified. Parent training services goal is for you to be able to have ample skills/knowledge in order for you to become more effective in addressing behavioral difficulties as they occur outside of scheduled ABA sessions. Depending on the goals established, you may be required to participate in your child's one-to-one sessions. These participations are a good way for you to practice what you have learned from the case supervisor while at the same time, having the behavior technician available to you to give you feedback as you practice on those new skills. As mentioned in the beginning, no two ABA agencies will do the same exact thing when it comes to providing ABA services. However, good agencies will always base their practice on the same empirically proven procedures.